Hi, my name is Dr. Rob Confessore. I'm a clinical exercise physiologist at the Summit Medical Fitness Center, and today we're going to be talking about an extremely important topic, hydration and the importance of hydration. I had to come up with a very catchy title for the talk, and I chose "We Came from the Sea, and the Sea is Within Us." From an evolutionary perspective, that is probably true. And we all know in an emergency situation when we're very dehydrated and we need intravenous fluids, one of the fluids that's given is salt water. So hydration is very critical to every facet of life. We really did come from the sea, and the sea is within us. When we look at the composition of the human body, it's pretty amazing, but the body is 60% water. Blood is 92% water. The brain and muscle tissue is composed of 72 to 75% water. Bone we think of as inanimate. It's not. It's made of living cells. It's about 22% water. And even a fat cell or an adipocyte is approximately 12 to 15% water. About 40% of the body's water is extracellular outside cells. 60% of the body's total water is located inside cells. And we all know there is no life as we know it without water. Interestingly, as we search for life on other planets, our probes are asking the question, where's the water? Was there water? That's how critical this very basic compound is for life on Earth. Fluids must move and they must circulate. I'll paint a picture for you. When water becomes stagnant, microorganisms develop within it. It's like mosquitoes being spawned from a swamp, water that's not moving. So think of blood, lymph, cerebral spinal fluid, synovial fluid within joints, all composed of very high percentages of water. Therefore, one of the basic tenets that we talk about at the summit, the body was designed to move, period. It was not designed to be sedentary. And that 60% water of our body is also designed to move. Functions of water. Interestingly, if you've taken survival courses, you know that we cannot survive, a human being cannot survive without water for more than probably 3 days, approximately 3 days. In a survival situation, food should be your last priority. Water should be your first. And here's some of the things, some of the functions of water. It lubricates joints. It's in synovial fluid. It helps us move. It forms saliva and mucus. It delivers oxygen to the body, with 92% of blood being composed of water and blood plasma. It boosts skin health and beauty. It cushions the brain, the spinal cord, and other sensitive tissues. It regulates body temperature within a very specific range. The digestive system depends on water for motility, to keep things moving. It maintains blood pressure in the human being, critical. The airways need it and require it. It makes minerals and nutrients accessible. It prevents kidney damage. And of course, it boosts performance during any type of exercise or physical activity. It really helps in weight loss and weight control. It's very filling and it has little calories. It's critical relative to the effectiveness of medications. Individuals are older individuals who are taking multiple medications. All of those medications were designed to work in a fluid milieu and a certain pH. If you're physiologically dehydrated and you're taking 10 or 12 medications, it's hard to calculate the medical interactions involved in all those medications. Remaining hydrated is critical. How much water do we need? The answer to that is about 15.5 cups, about 3.5 liters of fluids for men each day, and about 11.5 cups of fluids for women each day. Those two numbers involve water, other beverages, and food. About 20% of the daily fluid intake on average comes from food. The remainder comes from drinks, beverages, and pure water. That old adage of 8 8-ounce glasses, 64 ounces, the standard advice remains a very reasonable minimum goal. 1 liter, like a Halgene bottle, is equivalent to about 33.8 or 34 fluid ounces. You must modify your total fluid intake based on changing conditions. Exercise. Drink before you become thirsty. Drink before, during, and after a workout. Environmental conditions. In hot and humid weather, dehydration becomes a very great danger. High altitude hiking. One of the interesting things that cyclists and athletes do during extreme activity or all-day activity is they'll actually monitor urine color. When the urine is clear, that's an indication that you're well hydrated. When it's very yellow, dark, and concentrated, that's an indication that you are dehydrated. For overall health, whenever you have a fever, vomiting, diarrhea, bladder infections, you need to take in more fluid. And during pregnancy and breastfeeding, you also need to increase fluid intake and greatly increase fluid needs. That, in essence, is the importance of a compound that we cannot live without. On my last slide, I listed 3 primary resources if you require additional information and would like to do additional research. Remember that many, many years ago, coaches used to deprive their athletes of water because it made them tougher. That was probably the worst thing that a coach could do in terms of athletic performance. Drink water and take care.